Hello, everyone. Thank you for joining me today. Today, I will be informing you of the disease cholera. I will also discuss how it is contracted, how it is diagnosed, how to treat it, and most of all, how to prevent it. Cholera is also called blue death. It's a bacterial disease causing severe diarrhea and dehydration, usually spread in water. Cholera is an acute diarrheal illness caused by infection of the intestines. Between the 19th and 20th centuries, 7 great pandemics of cholera occurred and worldwide thousands of people died. Cholera bacterium is usually found in water or in foods that have been contaminated by feces from a person infected with cholera bacteria. Cholera is most likely to take place and spread in places with inadequate water treatment, poor sanitation, and inadequate hygiene. Cholera bacteria can also live in the surroundings of brackish rivers and in coastal waters. For instance, in Andersonville during the Civil War, there was a live running stream of water that flowed through the prison camp. The water upstream was used by the prisoners for more than just drinking water. This was used for bathing and toileting. The prisoners downstream utilized this same water for drinking also, but this flow of water was contaminated with cholera bacteria, causing many deaths. However, today we have very few cases of cholera in America. In developing countries like ones in Africa, there are many cases of cholera. A person can contact cholera by drinking water or eating food contaminated with cholera bacteria. The infection is not likely to spread directly from one person to another. So you can have casual contact with friends or family and not have to worry about contracting the illness of cholera. The infection is not likely to spread directly from one person to another. I think I just said that. Therefore, casual contact with an infected person is not a risk for becoming ill. Cholera infections are often mild or without symptoms, but can be severe. Roughly 1 in 10 people who get sick with cholera will develop severe symptoms such as vomiting, watery stool, diarrhea, or leg cramps. Rapid loss of body fluids can lead to dehydration or shock. Without treatment, death can occur within hours. To test for cholera, doctors must take a stool sample or a rectal swab and send it to the laboratory to look for the cholera bacteria. A lot of these tests are called the GWAT test. And doctors, they use this test to detect a lot of different diseases. Cholera can be successfully treated with oral hydration solution, or you can have a prepackaged mixture of sugar and salts mixed with 1 liter of water and drinking in large amounts. This solution is used to treat the diarrhea. Rehydration therapy is the primary treatment for cholera patients and refers to the prompt restorations of lost fluids and salts. Okay. You can prevent cholera by drinking and using safe water, thorough hand washing and soap and water, using toilets that are clean at safely managed facilities, eating foods cooked well and covered, washing and peeling fruits and vegetables, avoiding raw vegetables and fruit that cannot be peeled, cleaning food preparation areas safely. When finished cleaning, safely dispose of soapy water and dry rags. Do you all have any questions about cholera right now before we go on?
No.
Erwin?
Is there any cholera in the United States?
Very few cases of cholera is found here in the United States, but there, like as I said before, there are some countries right now that are going through war and different things that are trying to develop, and in those countries there are several cases of cholera due to inadequate water supplies and inadequate medical attention.
And what are some of the ways that you say can be prevented?
Thorough hand washing, practicing clean techniques when cooking, preparing foods, staying away from raw foods.
You said death can occur within hours without treatment, right?
Yes.
Okay.
In some cases. In some cases.
Raw food like what?
Fish.
Fish.
Okay.
Raw vegetables. I mean, some people with seafood boil, you just have to make sure your foods are fully cooked. Drink only bottled water, or you can boil your water, or water that is chemically treated. And as I said before, washing your hands, and after preparing foods, you want to make sure you clean up behind yourself. Now, some of the things that healthcare providers can look for in those that have contracted cholera, and when you're looking for signs of dehydration, would be a rapid heart rate, loss of skin elasticity, dry mucous membranes, low blood pressure. It usually takes anywhere from 2 to 3 days for symptoms to appear after a person ingests cholera bacteria, but the time can range from a few hours to 5 days. People with severe cholera can lead to severe dehydration, which can lead to kidney failure. So that's why you want to try to work on restoring those fluids if you ever contract cholera. And if you ever contract cholera, drink plenty of fluids and make sure you seek medical attention. When cholera patients are treated quickly, they usually recover without long-term consequences. Cholera patients do not typically become carriers of the cholera bacteria after they recover, but they can get sick if exposed again, so your body does not become immune to cholera. I mean, if you contract it once, you can contract it again. Antibiotics, sometimes in certain cases, people use antibiotics, and antibiotics tend to shorten the courses and diminish the severity of the illness, but they are not as important as rehydration. You want to make sure you drink plenty of fluids, because without those fluids, as we said before, the body can go into shock, and that can lead to death if not treated properly. Any other questions about cholera?
No.
All right, well, this will wrap up our little information about cholera. Just try to get those fluids replaced immediately if you ever come in contact with cholera. Seek medical attention. That is very, very, very important.